Just now. Welcome to this evening's webinar on understanding diabetes, myths, facts and solutions. My name is Dhanvi and I'm one of the doctors in our BAPS healthcare team. This year, with the support of Brent Health Matters, the healthcare team have launched a project called BAPS wellNESS. We started with a combination of live cooking demonstrations and exercise workouts to engage and raise awareness in the community. This project has been inspired by our gurus Guru Sai Maharaj and Guru Hari Mohan Sai Maharaj, who have both been keen advocates of healthy eating and lifestyle. Their disciplined diets focus on simple, nutritious foods. Their teachings and personal examples serve as an inspiration to us to maintain both a healthy body and spirit. As we know all too well, the South Asian community is disproportionately affected by conditions such as diabetes and heart disease, and so promoting a healthy lifestyle from a young age is critical for prevention. We recognize the importance of taking a well-rounded approach to health and addressing both the mental and physical aspects. With this in mind, the BAPS Wellness Project focuses on 4 key areas that can support good health in the long term. This includes nutrition, exercise, sleep management, and stress management. We've also released a new vegan and vegetarian recipe book as part of the BAPS Wellness Initiative. This book is a collaboration from doctors, nutritionists, and our satsangis to create tasty, healthier dishes for people to continue to enjoy the foods we love and is available in our bookstore. Our first wellness webinar focused on nutrition, and today we'll be learning about diabetes. I'm delighted to welcome our guest speaker today, Dr. Anjali Amin. She is a consultant in diabetes and endocrinology at Imperial College Healthcare NHS Trust and a clinical senior lecturer at Imperial College London. Her clinical interests include young and complex patients with type 2 diabetes. She has a research background and holds a PhD in the effects of diabetes on appetite and body weight regulation. With a strong commitment to medical education, she also holds a master's degree in education. We'll now hand over to Dr. Amin, who will speak to us, followed by a question and answer session with her. So if you have any questions throughout her talk, feel free to pop them in the chat and we'll come back to them later. So without further ado, Dr. Anjali Amin.
Thank you so much for the very kind introduction and for the invite to speak today. So I'm going to talk to you today about understanding diabetes, bring up some myths, some facts, and hopefully some solutions. So I want to very briefly just explain to you about how the body controls blood sugar. Now, we've got a number of organs that are involved in various hormones, and the one that is important here in terms of diabetes is the organ called the pancreas, which is found here within the abdomen, and it's an important gland which is involved in the control of blood sugar. And it produces hormones, which are just chemical messengers. They send messages to different parts of the body. And one of the hormones that the pancreas produces is insulin, which lowers blood sugar. So how do we keep a steady blood sugar? Well, we know that eating foods that contain carbohydrate, and I'm going to talk to you later on about carbohydrate, this raises the blood sugar. Now, what happens when you eat carbohydrate is the pancreas releases insulin into the blood, so the hormone that I've just told you about. And then insulin enables body cells to take up glucose for energy. It also allows the liver to store glucose to use later on. And both of these together lower blood sugar. Now, what happens when something goes wrong? Well, unfortunately, there are times when the pancreas either can't make insulin or the cells in the body can't see the insulin. And the net result of that is that the blood sugar stays high. And that is when you develop diabetes. Now, you may have heard of different types of diabetes. So the 2 most common types of diabetes are type 1 diabetes and type 2 diabetes. Now, these are very, very different conditions. Type 1 diabetes is when the body just cannot make the insulin. And type 2 diabetes is when the body can make insulin, but often it's not enough or it's not used efficiently. That is, the cells that need it can't see the insulin. In type 1 diabetes, generally, this is a disease of childhood or very young adults, whilst type 2 diabetes usually is a disease of adulthood, usually affecting adults over 45. But actually, in South Asians, the age of onset is much younger, and I have many patients who are in their 20s with type 2 diabetes. Type 1 diabetes often has no family history of diabetes, whilst there's almost always a family history of diabetes in type 2. And unlike type 1 diabetes, which cannot be prevented, type 2 diabetes can be prevented by a healthy lifestyle, and hopefully I will convince you of that by the end of this talk. So the risk factors for type 2 diabetes, there are so many of them, but they include age. As I've told you, it tends to be a disease of older people, but not always, particularly in South Asians. Family history, I've already told you, is important. Ethnicity, South Asians, yes, are very much at risk. And those who are overweight and obese are all at risk of type 2 diabetes. So you might wonder, why are South Asians particularly at risk? Now, it's thought to be for a number of reasons. Our genetics certainly mean that we are more resistant to insulin. That is, whilst our bodies can make the insulin, it is more difficult for the cells to see the insulin and to use the insulin. And what happens is we develop diabetes for this reason at an earlier age, but also at a lower body weight. And one of the interesting theories about why South Asians are thought to be at risk is that we come from parts of the world which have experienced famines, starvation, and it's thought that over years of evolution, we have adapted to being ready for starvation, and we have started to collect fat, mainly around the abdomen, as a mechanism to be ready for starvation and a famine. And unfortunately, this means that we have become at risk of diabetes. Whilst much of this we cannot control, we also have a wonderful culture and lifestyle which involves large family meals. However, much of our diet is rich in both carbohydrate and fat. As I've mentioned, most people who do have type 2 diabetes have at least one member of their family who has diabetes, usually parents, siblings. It is very unusual to develop type 2 without a family history. And having type 2 diabetes does increase the risk of children or future children developing diabetes. So what can we do to reduce our risk? Well, research has shown that for some people, combined lifestyle interventions, and this includes diet, exercise, and sustained weight loss, can be really effective. And this can reduce the risk of type 2 diabetes by up to 50%, so a phenomenal effect. So how do we diagnose diabetes? Well, some people have symptoms, not everyone, but some people have symptoms. The vast majority, I would say, have symptoms, but not always. These symptoms include feeling thirsty, passing a lot of urine, getting up at night to pass urine, losing weight without trying or gaining weight without changing anything in your diet or lifestyle, feeling excessively tired, getting more infections than normal, or blurred vision. So these are common symptoms of diabetes. And what can we do to diagnose it? Well, there are lots of things we can do to diagnose diabetes. Firstly, having symptoms and then presenting for tests. So a fasting blood sugar test, which can easily be done, but also another test called HbA1c, which is just a blood test used to both diagnose diabetes, but also to monitor people who already have diabetes. What I would like to stress is that you may know people who check blood sugars who have a little machine where they can just prick their finger to measure their blood sugar. We cannot use this to actually diagnose diabetes. This is only really for people who have established diabetes. So why is it important to control diabetes? Well, we know that diabetes, when it's not controlled, is associated with negative effects on the body. We know that people are at higher risk of both stroke and heart attacks. It's the commonest cause of eye disease, the most common cause of blindness in the Western world. It causes kidney disease, leading to kidney failure, and in end-stage kidney disease, it can lead to people being on dialysis. It can also affect the nerves that supply the feet and the blood vessels that supply the feet, and this can cause infections in the feet and, in the worst case scenario, amputations. So we know it's important to treat early in order to prevent the complications, and this can have benefits on your health lifelong. It can reduce the risk of you having a heart attack. It can reduce the risk of the complications that I've told you about, but also it can reduce the risk of people dying. So what do we do to actually treat diabetes? Well, there is no one size fits all here. It's a personalized approach to treatment. So what one person might have for treatment of diabetes might not be the same as somebody else, even within families. Most people that are diagnosed with diabetes will start with both diet and lifestyle measures. And if this doesn't work, they might need tablets. Now, occasionally we give insulin in people who often have had diabetes for a long time, who can't control it despite lots of tablets. And more recently, we've been using weight loss injections that you might have heard about that can be helpful to actually control both weight and diabetes. And the other thing I thought I would just mention, that it's not just about treating the blood sugar, it's also about treating the whole picture, so addressing other risk factors for things like heart attacks, such as smoking. And when you have established diabetes, your doctor would monitor you, usually every 6 to 12 months, but it can be more often in some cases. And the vast majority of people can be managed by their GP, but if they have complications, they may be referred to the hospital. And we have developed new community clinics which can also manage diabetes and can start all medications, including insulin. And then, of course, a lot of people with diabetes want to know what's going on with their blood sugars. So they can do the finger prick test that I mentioned earlier. And generally, if you're only on 1 or 2 tablets for diabetes, there's really no need to do this. And this finger prick testing is really for people who are on 3 or more tablets, or those that are on insulin. Now, the most important thing is that diabetes can be reversed, contrary to what you might think. And the most effective way is really through sustained weight loss. And we know that, I stress the word sustained because, of course, you can reverse diabetes through weight loss, but if you then regain the weight, the likelihood is that diabetes will come back. Now, it comes with a caveat that the best chances of reversal of diabetes is early after diagnosis, so usually within the first 5 years of diagnosis. After that, the chances of reversal are much slimmer. So, what can we do in order to reverse diabetes? Well, I've talked to you about lifestyle, culture, and diet. It's really important in South Asian communities. And you will all be familiar with this sort of plate, a typical Gujarati diet, rich in carbohydrates, rich in fats, rich in sweets, and large portions. Now, of course, this all looks delicious, and from time to time, I will, of course, indulge in this, but we cannot eat like this every day if we want to avoid getting diabetes. So what I would say is that we need to move towards thinking about a healthy plate, so a balanced plate, so looking to have at least 50% of that plate being vegetables, and then including some carbohydrate, which I'm about to talk to you about, also some protein, and a small amount of fat. And if you're going to choose a fat, I would choose unsaturated fat, and this is why. Of course, these bhajiyas are absolutely delicious, but we know that fried foods are all very high in saturated fat. So ghee, coconut oil, fried foods, all are high in saturated fat that is a risk factor for heart disease, a risk factor for heart attacks. And we know that people who eat more fried food are more likely to die prematurely from things like heart attacks or strokes. So how can Gujarati food be made healthier? I know this sounds very obvious, but we need to eat smaller portions. And I know this is difficult, but there are ways of getting around this. So, one of the ways that I often tell my own patients is that instead of taking a lovely uh, big dish, maybe use a smaller dish. You know, rather than eating with a dinner plate, maybe eat with a slightly smaller plate. And that way you can reduce your portion size. Typically, the Gujarati diet is high in carbohydrate, as I've shown you, and we probably need to eat a little bit less carbohydrate and increase the amount of protein, increase the amount of vegetables that we eat, and definitely to cut down on sweet dishes. I've mentioned that fried foods aren't good for us in terms of heart disease and saturated fat, and that includes reusing the oil because this is high in things like trans fats, which aren't good for us. We can also avoid adding butter or ghee to rotis, to dal, to rice. Use oil rather than butter and ghee to cook with. Use low-fat yogurt, skimmed or semi-skimmed milk. Also using wholemeal rotli flour instead of white flour. Consider other types of flour such as ragi. Sometimes, a mix of these flours can work well for things like rotlis. Switching to wholemeal basmati rice instead of white, and I'll tell you why. That's because mainly we know that foods that have the husk on it, so wholemeal flour, wholemeal rice, have what we call a lower GI index. So that means that they are digested more slowly, which results in less of a peak in the blood sugar after they've been eaten. And one of the tips that I could give you is using things like quinoa, which is high in protein, mixing it with rice. I often put quinoa in khichdi and increasing the dal to rice ratio for things like khichdi. And if you are somebody that likes snacking, then go for things like roasted nuts and seeds rather than going for a biscuit or some crisps and things like that. Now, this is something I get asked about a lot. Does physical activity actually help? And I say this helps always. So when I talk about lifestyle measures, I am not just talking about diet. It's really important to stress that exercise is essential. It will help with regulating blood sugars, it can reduce the need for medication, and it will lower your risk of having a heart attack or stroke. So, of course, it is absolutely essential. I aim to do at least 30 minutes 5 times a week. And again, there is no one size fits all. The exercise that you do needs to be suitable for you and any health problems you might have. So, for example, if you have issues with your knees, running might not be the right sort of exercise for you. You might want to think about something like swimming. And the other thing that is important to remember is that it needs to be sustainable in the long term. So if you are not somebody that likes going to the gym, don't get a gym membership. Okay, find something that you like doing, that you're going to stick to doing. And I would really strongly recommend that you see exercise as an investment into your health. Now, many of us are happy to invest in things that are good for our diet and skin and sleep, but exercise also really needs to be seen as an investment into health. And I just wanted to touch upon fasting. Now, I know many of us fast for various reasons. It's always a personal choice. Now, in the absence of diabetes, actually, intermittent fasting has been shown to have health benefits. Now, in those that have diabetes, that are on medications such as insulin or have complications from diabetes, there are risks of fasting, the risks of sugar going low or becoming dehydrated, but there are healthcare professionals that can support people with diabetes that want to fast. So, how do you access help in people that don't have diabetes? So, I would really recommend that if you're age 40 to 74, take advantage of the free NHS health check. Anyone in this age group can go for an NHS health check. It will determine your risk factors for diabetes and it will test you if it's needed. Now, I would stress that people of South Asian descent can be tested earlier. Please go and discuss with your GP if you are worried that you might be at risk of diabetes. And one of the things that I think is quite useful is actually to do your own risk score, and this is a risk score. This is the website that you can just log on to, and it's run by a charity called Diabetes UK, and it'll ask you a few questions, and it will allow you to calculate your own risk of diabetes. Now, many people come to me and ask me about borderline diabetes. What does that mean, borderline? Well, actually, the true term is non-diabetic hyperglycemia. Some people call it pre-diabetes, and it's a condition which is, like it says, pre-diabetes. It's the time period before, if you leave it as it is, will eventually develop into diabetes. And this condition can be confirmed by doing a blood test. As I said, it is a risk factor for developing diabetes. So this really is the time when you can address your diet and lifestyle, and you can really, go to town on preventing diabetes by making those changes when you have borderline diabetes, and making an effort in terms of your diet and exercise at this time can prevent diabetes from happening altogether, or it can delay the onset of diabetes. And one of the really important things that has happened in the UK in recent times is the Healthier You programme. And this is a national programme which is known as the Diabetes Prevention Programme. And all people who have this borderline diabetes can be referred to this free of charge through the GP. And it is a 9-month programme which can be done either face-to-face or online. And you get personalised support to manage your weight, to manage diet, and encourage you to be more physically active. So I really would recommend that if you fall in that bracket of pre-diabetes, to go and ask for referral for the diabetes prevention programme. So how can your doctor support you? Well, dietary advice, I've told you, is really, really important. They can refer you to the Healthier You or your local diabetes prevention programme if you do have non-diabetic hyperglycemia. But also they can assess your risk of having a heart attack and stroke by looking at other things like medications for cholesterol, measuring your blood pressure, talking about smoking if you are a smoker. And also they can screen other family members at risk. So I'm going to stop there, and hopefully you might have some questions for me. So thank you for listening.
Thank you so much, Dr. Amin. That was really useful. I particularly love how you highlighted that although type 2 diabetes is really prevalent in our community, there is something we can do about it to prevent it, and there is something we can do about it if we've already got type 2 diabetes to help manage it better or prevent some of those effects on our body from it. Dr. Amin, I was just wondering if I could ask you a few more questions, maybe in a rapid fire round, because I've seen lots of tips and tricks and hacks floating about social media on WhatsApp groups and on Instagram. And I was wondering if you could shed some light on whether they're actually helpful or whether they're complete myths.
Absolutely. I'd love to hear them.
Okay. So jaggery, gore, people say it's better for you, is it?
So, ultimately sugar equals sugar. And whilst gore is, unrefined, so less processed than, table sugar, it does the same thing within the body. Now, some people say, well, it's a bit more nutritious. Actually, the effects, unfortunately, are the same. It's the same as having honey. It's the same as having white sugar. Really, in terms of diabetes, it makes no difference.
Oh, to know. What about freezing bread or toasting bread?
That's really interesting. And this is really to do with the structure of bread. So actually, it is useful to freeze bread and then toast it. And the reason is that when you freeze bread, it changes the actual starch content, the resistant starch. And actually, when you then toast it, it makes it it makes it actually less digestible, which means that the sugar from the bread is released more slowly. And actually that's better than getting the peak in the sugar that you otherwise would have got, particularly from things like white bread. So yeah, there is truth in it. And I would recommend it also just to reduce food waste. It's great all round.
Really good to know. And I guess the same concept applies to other carbohydrates like tebla.
Absolutely. I think less is known about the wheat flour. I mean, we know about sourdough being particularly good in terms of the resistant starch. Thibla, actually, I don't know about, but I'll be honest with you, I always freeze my thibla and use them. So I think it might be good.
Okay, I'll give it a go. What about apple cider vinegar before meals? Is there any science to that?
Oh, do you know, there really isn't good scientific evidence. There is some science, there is some very small studies that show that having apple cider vinegar before a meal might reduce the blood sugar, but it hasn't been proven in terms of evidence. And actually, it's really bad for your teeth. So if there are any dentists on, I'm sure they will agree that probably it's not the best thing to do.
And should we be going for a walk after dinner? Or does it matter when we go for a walk?
Do you know, actually, I think that is probably the single most useful thing that somebody could do, particularly those that have diabetes, because we know that exercise will reduce blood sugar. So if you eat your meal, your blood sugar is going to go up. So by actually going for a walk, you're burning off some of that sugar and bringing it down naturally, potentially without the need for medication. So definitely a win-win.
Yeah. And how about coconut oil? Is coconut oil better than you mentioned that we should be trying to avoid ghee, but how does coconut oil compare?
Well, coconut oil is also a saturated fat. So, actually, in the grand scheme of things, we should be avoiding too much in the way of saturated fat. So, I would class butter, ghee, coconut oil probably in the same bracket. If I was going to choose an oil to cook with, probably I would choose something like olive oil, which is likely better for us to both cook with and to consume, even in things like salad dressings, etc.
And when I go to the supermarket, I see lots of foods that are marketed for diabetics, diabetic-friendly biscuits, and other sugar-free snacks. Are they good for you?
So I don't think any of them are particularly good for you. I think snacks are snacks ultimately. Now, whilst diabetes shouldn't be seen as having, a really detrimental effect on someone's life. I think that you are allowed to have a snack from time to time. And the good thing about the diabetic snacks are that they use artificial sweeteners, which won't put your blood sugars up. So actually, if you want a snack, my advice is to go for things like the nuts, the seeds. But if you want to have a diabetic friendly snack from time to time, that's okay. And as I said, they are better than going for a standard biscuit or cake or whatever it is.
Okay. Oh, cool. And talking about alternative sugars, how about things like stevia? Are they good for you? And what about the other sugars?
It's interesting. So, stevia and other artificial sweeteners actually are probably at least 100 times, our brain sees it as almost 100 times sweeter than sugar. Now, what it does mean though, is that whilst the brain might see it as sweeter than sugar, our bodies don't see it. So actually, they are better for people with diabetes than consuming sugar. There's a lot of research currently going on in artificial sweeteners. I don't have all of the answers, but I think if you are somebody who naturally wants to have sugar in your tea, actually stevia is a better option. Or if you want sugar in, a cake or something like that, is a much better option than sugar for somebody with diabetes.
And what about, I've seen lots of videos of people squeezing lemon over their food. Does that help?
No evidence for that.
No? Complete
No
myth.
myth,
Okay.
I'm afraid.
And cinnamon on your food or using cinnamon pills?
Again, myth. There are small studies that have looked at cinnamon and the effect on reducing blood sugar. And whilst it's interesting, the evidence just isn't out there. And also, if it the amount of cinnamon you would need to eat to make a significant effect would just be impossible, even in a pill. So no, there isn't good evidence for it.
Okay. What about detox teas and juices?
So my advice is save your money. These things are marketed to people who want a quick fix for something. There is no quick fix for this. If I can stress one thing, it is to go for your address your diet and lifestyle, not look for the detox things. They are not helpful for people with diabetes, and unfortunately, they're really expensive, and people shouldn't buy into them. Is
They
my
are. They are. Okay, I'm glad I asked you so that I can save my pennies a little. And what about Ayurvedic or herbal medication?
So, whilst of course all of my patients, I always, encourage them to follow what they believe in. I think it's important to know what you are taking, and that is to know what herbs, whatever it is that you're taking, and to do it alongside your doctor. And I think that is the key here. Know what you're taking. Don't shun the Western medicine because it is based on science, it is based on evidence, but it does need to be done simultaneously. And just be upfront, I think, with your doctor. If you want to take Ayurvedic medicine or herbal medicine, just be upfront and bring to them what you're taking so that they can see to make sure it doesn't interfere with, some of the other medications you're taking.
Do you know much about the alkaline diets that everyone's talking about?
Well, there isn't much evidence. So the alkaline diet, unfortunately, is slightly scaremongering because it tells people that, you can't eat things like dairy, for example, and, you should just be eating vegetables. Now, whilst vegetables are great, and I would never not advocate increasing vegetables, there is no evidence that actually eating alkaline foods is better for diabetes. And we know that once the food gets into the stomach, well, of course, it's all pretty much acidified by the stomach acid in there. And we also know that the body regulates its own sort of acidity levels really well. So actually, there isn't, good evidence for an alkaline diet in diabetes.
Okay. And what about things like superfood powders and other superfoods, things like spirulina and maca root? Do they help?
No evidence that actually they help regulate diabetes. Again, a lot of it is in the branding and marketing, and there isn't good evidence that they're helpful in diabetes.
Okay. And what about calorie counting? Should we be counting our calories to try and reduce our portion sizes?
Well, actually, whilst I never advocate for people to be so concerned about their diet that they are looking at every single calorie. We do know that low calorie diets help reduce weight. So actually, that is probably useful in some people. And, it can be used, but not to the effect that people become obsessive over it. But yes, it can be useful because people will automatically reduce their portion size if they count their calories and they try and stick to a calorie count.
Okay. I guess we just need to be careful about not reducing our calorie count so much that we're only eating the unhealthy stuff, but less of it. All right, thank you, Dr. Amin. That was really, really useful. I can see that's inspired lots of questions in the chat, which we'll definitely have a read of and come back to in just a second. But before we get on to the next portion of the Q&A, let me invite two other members of our healthcare team, Dr. Rakesh Bhai and Dr. Neil Bhai. Rakesh Bhai is also a GP working in South London, and so it'll be helpful if you could answer some questions from your perspective as both a Gallagher and as a GP. Rakesh Bhai, let me start by asking you a question to give Dr. Amin a break. Can you tell us a little bit about what are the common questions or concerns that Satsangis come to you with regards to diabetes? What problems do you think are most important to address for our community specifically?
Yeah, it's a really good question, and thank you, Dr. Amin. That's been a really insightful talk. It's the questions that come to me is essentially saying I'm finding it really, really difficult to make the lifestyle choices to reverse my diabetes or control my diabetes. I think we hear about 30 minutes of exercise 3 times a week, then NHS guidance on what you should be eating, but that's a world apart from what we're doing right now. And people find to make that switch very, very difficult and quite overwhelming. So the advice that I pretty much give everyone is to make small steps which are sustainable and create habits from them. So Dr. Amin spoke about the Gujarati thali and how we can reduce some of the carbohydrates. So that, for me, is something which is fairly simple. If you can reduce perhaps the number of chapatis or rotli you eat every day, and make that sustainable and a habit, then actually over the long term, that should help you shift some of the weight, but also improve your diabetes control. And the same thing goes with exercise. So we often hear, I haven't got time to do the exercise. It doesn't fit into my day-to-day activities. Life can be quite stressful, work, family, etc. So it's about building exercises into your daily routine, and that might be something as simple as getting off the bus one stop earlier or the tube one stop earlier, but what I'm a keen advocate for is sort of linking good habits to habits that you've already got. So I use this one, which is fairly simple. A habit which everyone does twice a day is brush their teeth. So adding some exercise into that, so just doing simple squats every day, twice a day, and linking the good habit with a habit you've already created and got just makes it more sustainable. And I always tell people that it's a process of time. So if you keep doing the good things regularly, you will see the change, and just persist with it. Don't go about making huge, substantial changes which you may not be able to continue through long term.
Thank you, Rakesh, for that answer. That was really helpful, and thank you to Dr. Anjali Amin for covering so much in that talk and so concisely. I guess there's a few questions that are recurrent in the chat, and of things that you touched on that maybe we can expand on from the rapid fire round. And one of those is about intermittent fasting. So a lot of people hear about that. Maybe some people who are diabetics thinking about, will that help their long-term control, but also those who are not diabetic but looking to reduce their risk of future diabetes. So could you expand a little bit more about intermittent fasting, its benefits, and also risks, or what people maybe should be careful? That's for Thank you.
Do you want me to take it?
Yes, please.
Okay. It's really interesting. And actually, for those of you that don't know about intermittent fasting, otherwise known as time-restricted eating, and the studies have shown that if you eat the same foods within a shorter window, so within 8 hours, now naturally most of us on a day-to-day basis eat in a sort of 12 to 14-hour window. We get up in the morning, we have breakfast early, and then we have dinner late. And so, our eating window is about 14 hours. Now, if you had the same amount of food within a shorter window, actually, it seems to be better for you in terms of your metabolism, in terms of blood sugars, in terms of weight. And so it's quite an easy way of actually changing your lifestyle without having to change too much of your lifestyle. So you might just say, well, actually, I'll eat the things that I like eating, but I'm just going to do it in a shorter window. Now, what I would say is actually, you should look at your diet and make sure that things that you're eating are good quality, but eat them in a shorter time frame. And if you don't have diabetes, or you're not on medication for diabetes, then I think it's great. Now, the challenge is for people that are on medication for diabetes, and it is slightly more risky if you're on medication for diabetes, because it can mean that your sugars might go low in the time that you're actually fasting. So it's not without risk. And actually that time window, that 8-hour window, isn't fixed. So it could be that you get up early in the morning and you stop eating at 4 o'clock in the afternoon, or you miss breakfast and you start at 11 and you finish at 7. So actually the timing is less of an issue. So yeah, there is good evidence for it.
Dr. Amin, another one for you. I'm sure there's lots of questions about gestational diabetes, which isn't a topic that we've touched on at all, but I was just wondering if you could tell us a little bit more about it and what that means for individuals who may be suffering with diabetes when they're pregnant.
Very interesting. So gestational diabetes, for those of you that aren't familiar with it, is diabetes that just occurs in pregnancy and goes away when you deliver the baby. And actually, I always tell patients that I see with gestational diabetes that this is the insight that you needed, 10 years down the line, because it shows those people that really are at risk of type 2 diabetes. Now, pregnancy makes people more insulin resistant, and that's why they develop diabetes in their pregnancy. And when they deliver the baby, the diabetes just goes away. Now, unfortunately, 30% of people who have gestational diabetes will develop type 2 diabetes within 5 years. You know, we're talking about women that are in their 20s, 30s, early 40s. So it's really important that if you have gestational diabetes, you need to remember that that is you seeing that 10 years down the line you will have diabetes more than likely, and can you do something about it now to try and prevent the onset of type 2 diabetes?
Thank you very much for that one, Dr. Amin. There's another question which I guess maybe you could take, and then we'll do one for Rakesh after, and it's specifically about gliclazide and metformin, about which one's better, but more of a generic question of what some people might perceive to be a better medication for diabetes than other medications. You touched on it in your talk, there's a wide array of treatments for diabetes, but is there truly one that is better or not? Or could you help answer that question that's come through in the chat? Thank you.
So actually, I would say that the single most studied and most useful drug in type 2 diabetes, and hopefully Rakesh will also agree, is metformin. And it is the drug that really tackles the underlying problem in diabetes, which is insulin resistance. So metformin is pretty much the only drug that does that. And the way that gliclazide works is it stimulates the pancreas to actually release insulin. And in the longer term, actually, what it does is it exhausts the pancreas. So actually, if you're going to choose one drug, actually metformin is the drug of choice. As I said, it's been around for, I think, almost 50 years, and it's so well studied. And it is excellent because it doesn't cause low blood sugars. If you can tolerate it, you can take it forever. So I hope that answers the question.
Just to add to that point as well, is that one of the reasons that we see in general practice that people don't particularly like metformin are some of the side effects which are associated. But there are different forms of metformin that we can use which might have a lower side effect profile. And what we do find is if people do persist with the medicines, actually the side effects do wear away. And as Dr. Amin said, that it's the single best sort of treatment that we've got for diabetes. So for people who are experiencing side effects, I think it's certainly worthwhile them speaking to their GP to see if there's another option available, but just to persist sometimes as well.
Rakesh, there's another question in the chat for you. Are there examples or case studies of people who have actually successfully reversed type 2 diabetes?
Yeah, so I can give two case studies. One is someone from the Mandir actually who was diagnosed with type 2 diabetes, and it put them into shock really, and they really looked and reflected upon their lifestyle and what they could do as an individual to reduce their future risk of things like cardiovascular disease. But what really they wanted was, they were told by their doctor that they needed to start insulin after being diabetic for a little while. So what they did was basically make a promise to themselves, and they got themselves a pedometer, back in the day it was, but a smartwatch that can count your steps, and made sure they did, I think it was 12,000 steps every single day. And they ensured they did that and sustained it over a long period of time, and added in extra exercises as they got better with doing the 12,000 steps. So that gentleman, I think he might actually be in the chat, managed to come off the insulin, and their HbA1c, which is a blood test that we use to diagnose diabetes, which gives you an average of your blood sugar, actually went into non-diabetic range. So that's one really good case study. Another case study is a patient of mine who was significantly overweight, and they did intermittent fasting for a long period of time, and they managed to do it. And how they did it was they'd give themselves 5 days a week where they would intermittent fast, and the weekend they'd give themselves a break. So they had something to look forward to. And again, their blood sugars dramatically fell, and they did reverse their diabetes completely. So those are just two case studies at the top of my head, but I'm sure there's numerous other ones within the Mandir and actually within practice as well.
Thank you for that, Rakesh. We'll go back to Dr. Amin for the next few questions. Maybe it's sort of an extension to the rapid fire round, if you may, because there's a couple of questions coming through about certain things to eat or to do that may or may not help with diabetes. So a couple of them in a row with you, Dr. Amin, if that's okay. So one is about spelt flour or spelt bread. Some of these are covered in rapid fire, but maybe we'll expand on them. But the first one is spelt flour, please.
Yeah, I mean, spelt, if you can get wholemeal spelt, actually is better than white wheat flour. So definitely I would advocate using wholemeal spelt flour if available.
Okay. Another one is about, you touched on sweeteners, and there's a question in the chat if artificial sweeteners and their effects on insulin and weight gain.
So it's difficult. Artificial sweeteners are a very difficult area because they're poorly understood. And whilst, you know, I don't want to make my patients with diabetes unhappy because they can't eat sugar, they have some benefit in that people get the sweet craving that many people need. Now, there are studies that show because they are so sweet, people actually can sort of can then end up more sweet cravings as a result. And so I think there's a lot of research going into artificial sweeteners at the moment. I think the jury is out in terms of, whether they help, in terms of insulin resistance. I think we just don't understand enough about them at the moment.
Okay, thank you. The next one is about processed nuts, so pistachios, peanuts, cashew nuts.
Yeah, absolutely. And remember, nuts will really vary in terms of fat content, etc. And so, actually, whilst I said generically nuts are a good snack, we know that nuts such as macadamia nuts, pistachios are slightly higher in terms of fat content. So we know, things like almonds, actually, badam, great, lower fat, and actually are a good source of protein, nutrition, vitamins. So yes, choose the nuts wisely when you do go and snack on them.
Okay, thank you. We'll take probably one more of these before I hand back. Ginger lemon water. You touched on lemon on food, but specifically about ginger lemon water helping with diabetes.
No, there's no evidence ginger lemon water helps. By all means, ginger is a great root. Of course, there are lots of things in traditional, Indian custom, ginger, turmeric, etc. So whilst they're great for you, there is no evidence that they actually help regulate the blood sugar.
Some more from the chat, maybe for Dr. Amin, because Sadakashri's already touched on this. If a person has had type 2 diabetes for the last year and he's on medication, would it be possible to stop the medication totally and come out of type 2 diabetes? Maybe this is a good opportunity to touch on the legacy effect again.
Yeah, I mean, it is. It depends, though. Like once you're on medication, you have to make those significant changes to your diet and lifestyle in order to come off that medication. So within a year of diagnosis, yes, of course, the chances of you reversing, as I said to you, in the first 5 years are higher than after 5 years. But in order to come off the medication, actually, you do need to make those significant changes to your lifestyle. Don't forget also that many people have been undiagnosed with diabetes for, the actual pathology that causes diabetes is thought to start over 10 years before diagnosis. So, all of those changes to your blood vessels, all of the changes to the liver, etc., all happen even before you are diagnosed. So once you are diagnosed, you really have to act quickly. And so I think once you're on medication, and I definitely would still advocate to really try hard to address the diet and lifestyle, because yes, it's possible.
Thank you. I think I will give the next question to Rakesh Bhai. There was a question which I guess is relevant to our current wellness project about what sorts of thoughts might you recommend to someone who starts the intentions of making the right choices with either their diabetes or reducing the risk. So it's about what sort of thought processes might help with that.
Yeah, so I think the first one is just a reflection. So having to think about where you're at right now, what your risk is and what's going on with your own health. And then start thinking about what the choices that you can make are. So I think it's, again, as I reiterated earlier, it's about making those small sustainable steps. So not to try and think too big or too far ahead, but make small changes which can be reproduced daily, which will be impactful over a period of time. It's almost a compounding effect of having good habits. They'll build up and then you'll see the results at the end of that. But again, it's very much individualized, but trying to do things which are easy and sustainable is probably the most important thing about making changes, especially with lifestyle and diet.
Roman, there's a few questions coming in about diagnosis. If my GP says I have type 2 diabetes, but hospital glucose tolerance test is negative, how do I know if I have it or not?
Oh, that's difficult. I mean, it's unusual for your GP to have done a test that isn't a sort of confirmation test. So usually, and most GPs would probably do something called the HbA1c. A glucose tolerance test really only is done in pregnancy, generally speaking. So I guess outside of pregnancy, actually no one really needs a glucose tolerance test any longer. We would just do either 2 fasting glucose readings or an HbA1c. I think if there's any discrepancy, I would just see the GP and ask for another HbA1c.
Thank you for that. Yeah, there's several questions in the chat, a lot of which Dr. Min has covered earlier in the talk and the Q&A, and this will be all available on YouTube as a video after as well. The next question, we'll start with Rakesh and then maybe Dr. Amin can add as well, is about fasting, which you covered in your talk a bit, Dr. Amin. And, regularly our satsangis, they fast. We have upvases, we have nirjaras where they don't eat anything. And often there's big event days or utsavs where there's thousands of people spending many hours in the mandir. And Rakesh, during these events, and we often meet diabetic patients who are not feeling great during fasting. So could you tell us a little bit more about what the recommendations are for people fasting when they've got diabetes?
Yeah, absolutely. So it kind of relates back to what Dr. Amin said about intermittent fasting. So if you're not diagnosed with diabetes and you're not on any medicines, then I think it's fairly safe for you to fast throughout the day. And I appreciate there's different types of fast. So you may be eating certain types of fruit and vegetable and other foods which are absolutely fine. But of course, some people on special occasions perhaps will spend the whole day having no food at all. So in those situations, I think it's fairly safe to do. It's just about being mindful if you are taking any medicines. And the medicines that we're particularly concerned of if you're diabetic are medicines which drop your blood sugar. So those may be things such as the glycoside, but certainly things like insulin, because what we don't want to happen is for your blood sugar to drop too low, where you may feel faint and may collapse as well. So it's about knowing what medicines you're taking, if you're taking any, and knowing the risks associated. But I do think there's some really good resources online, but also having a word with your diabetic nurse or GP in regards to the medicines you're taking, and perhaps understanding exactly how they work. So certain medicines will drop your sugar, and if you're fasting, that might exacerbate the problem. But other diabetic medicines wouldn't drop your blood sugar, and therefore I think it's fairly safe to be fasting.
And Dr. Amin, is there a particular order in which we should eat our meals?
So that's interesting. Not really. I mean, we know that the different food groups have effects on how the stomach empties. So, for example, we know that when you eat a protein-rich meal, actually it stops the stomach from emptying as quickly, which is probably better for blood sugars. So, another reason why actually eating protein is good for you. The actual order itself doesn't matter. And I know I see things on social media about, you should eat the vegetables first, and then actually it really doesn't matter. And my recommendation is always going to be go for your healthy plate. Eat all of those foods, the foods that you'd like in moderation, but really make sure half of your plate is vegetables. The order, actually, there's no evidence that makes a difference to diabetes.
I'm going to jump in here. So it's a question which I'm really interested in, and it's a question that's there's a lot of interest in the media regarding, which is the weight loss injections. And people do speak to me about starting them. Just wanted to get your view on them, Dr. Amin, about in terms of one, diabetes, but two, in terms of weight loss, because as you mentioned earlier, one of the significant risk factors of diabetes is increased weight or high BMI. So just wondering what your views were on these weight loss injections that we're hearing about in the media.
Yes, thank you for that question. I think the weight loss injections have really changed the landscape for people who are overweight and people that have diabetes. Now, of course, I will never not advocate diet and lifestyle and making those sustainable changes first, and even on weight loss injections, those changes should be done in conjunction with diet and lifestyle. However, I do accept that it is difficult for people to lose weight, even with making changes to their lifestyle. And we know that weight loss injections actually are really effective in helping people to lose weight. They're not without risk and they do have side effects. And so I would definitely not advocate people buy them, because you can buy them online. You need to do them with a healthcare professional because, as I said, they are not without risk. Now, the caveat again with these injections is that they are only useful for as long as you are taking them. So if you take them for a year and then stop, that weight will just go back on again. So if you have to think, I'm embarking upon this with a view to either this is going to be I'm going to be on them for life, or I'm going to have to make serious changes to my lifestyle so that I can maintain the weight loss that I get. And the other thing that is really coming out recently is the need to increase the amount of protein that you have in your diet when you use these weight loss injections, because what they do is they reduce weight, not just fat, but muscle bulk as well. So really important to do strength training exercises and to increase protein in your diet. So yes, they're useful, not without risk, and your weight will go on when you stop them.
I think we could go on. That was really, really useful, Dr. Amin. I think we need to draw the session to an end. But thank you so much, Dr. Amin, for preparing and for giving the session to us. We really value your time and all the energy that you've spent in preparing everything for today. And we look forward to welcoming you to Monday soon. For everyone who joined late, this talk will be available on YouTube afterwards. As mentioned earlier, this webinar is part of our wider wellness project, and the next webinar will be focusing on exercise on Monday, 16th December. So that's a date for your diaries. Once again, thank you, Dr. Anjali Amin, and look forward to seeing everyone again on Monday, 16th of December, just now.